In this lesson, we'll take a look at the general anatomy of the heart. In this video, we're going to focus on the Brown heart model. Let's start with taking a look at the external features. So this is an anterior view of the Brown heart. Just to give you an idea, if I flip the heart around, this would be a posterior view. So listen, this is how you distinguish anterior from posterior when you're kind of beginning. Look for this big blood vessel right here. This is known as the coronary sinus. I don't have it labeled here. We're going to talk about it on a separate lesson. This is the coronary sinus. This is always in the back. This is posterior. So look for that, and that'll tell you you're looking at a back view. So let's flip it back to an anterior view. So just to give you a little bit of an idea, this side of the heart here is the left side of the heart, and this is going to be the right side of the heart. We're going to see this top left here and the top right here are where the atria are. The atria, these are the upper chambers. Then down over here, this would be the right ventricle area. And then over here, this would be the left ventricle. Those are the two bottom chambers, right? So I labeled the left ventricle here and the right ventricle. Now, we don't see the atria completely. We do see the outside of the atria. This pouch right here marks the outside of the atria, and this is known as the left auricle. It's able to absorb extra blood that's returning to the left ventricle. And then we have the same thing here. We don't see the atrium on the right, the whole chamber, but we see this pouch on the outside. This is the right auricle. Okay, so we have a right auricle and a left auricle. Now, there is a groove right here in the front. This is known as the anterior interventricular sulcus. Sulcus is just a word for a groove, and inter means between. Ventricular is the ventricles. So it's a little bit hard to see the entire groove because blood vessels are in there and fat's in there. But if we were to strip out all of these blood vessels, we would see a nice big groove. One other groove that we can see from the front, this groove here that's going to separate the atria above from the ventricles below, we see it here, and we can see it like right here also. The problem is it's filled with blood vessels. Now this groove also continues around the back of the heart. This is known as the coronary sulcus. Again, sulcus meaning a groove. Now, the heart you can see is a triangle. This top part, I didn't label it, but this is the base. This is where the great vessels are right here. And then if we look at the heart, kind of triangular, the tip of the heart down here is the apex, right? So that would be the pointy part of the triangle. So let's flip it around to the back. Just again, some of the things that we could see. Here's that groove that I showed you before from the front, but now we see it in the back also. The coronary sulcus, again, that goes around the entire heart, separating the atria from above and the ventricles from below. All right, so now we're looking at the heart from the back. So this is the right side. Here's the right ventricle. Here's the left ventricle. One other groove I want to show you. Right in here, between the ventricles, here's the right ventricle again, and the left ventricle, that groove right in between, this time is the posterior interventricular sulcus. Again, posterior meaning the back, inter meaning between, ventricular, the ventricles. All right, and then again, here's the apex from the back. So those are the main exterior features of the heart that we want to take a look at. So now we have the brown heart. We do a frontal section, right? We cut it into frontal plane, and we have a section here where we're looking at the internal features. So we're going to see those four chambers now pretty well. Over here, this is the right atrium, and then if we flip over here, left atrium. All right, this is an anterior view, so this is the left side of the heart again. Here's the right side of the heart. Dropping down, right ventricle, left ventricle. Now we do have some walls that separate the atria from each other and the ventricles from each other. So This thin wall right here, this is made of connective tissue. This is the interatrial septum. Again, inter meaning between, atrial being the chambers, and a septum is a wall. Right? So that's a thinner connective tissue wall. But look at the ventricles this time. This wall right between the left and right ventricles is much thicker, and you can see it's actually made up of cardiac muscle. This is the interventricular septum. Okay, so those are the major chambers. So on the next couple slides, let's take a look at the features of the right atrium first. Then we'll jump down and we'll take a look at the right ventricle. Then we'll take a look at the left atrium, and we'll finish up by taking a look at the left ventricle. So let's start with the right atrium. This will be an interior view. So we can see the entire chamber. I just kind of blew it up a little bit. So some of the things we're going to see, there's 3 blood vessels draining into the right atrium. This guy right here, look at the size of this. This is a big one called the superior vena cava. Now we don't see the big inferior vena cava, but here's the opening to it. There's a blood vessel coming from below the heart, draining blood up. This is the opening for the inferior vena cava. And then the third blood vessel draining into the right atrium is the coronary sinus. That was that big blood vessel that you looked at to tell you that you're looking at the back of the heart. Remember I said it goes across the back of the heart? So that's opening up right here. So here's the superior vena cava. Here's the opening to the superior vena cava. So that's the first blood vessel draining into the heart. Here's the opening to the coronary sinus. That's the second blood vessel draining into this right atrium. And then right here, this light area, this is the opening to the inferior vena cava. Those are the 3 blood vessels draining blood into the right atrium. Right here in fetal life, I'm going to leave my laser right there. Right there in fetal life, there is a hole in the heart that allows blood to go from this chamber here, the right atrium, directly across behind this blood vessel into the left atrium over here. That hole is called the foramen ovale. Since the baby, the fetus, is not breathing, we don't really need to send a lot of blood to the lungs for oxygenation. Right? The baby's not breathing yet. So that hole kind of just bypasses blood going to the lungs. When we take our first breath, that hole closes. So it goes from being the foramen ovale to the fossa ovalis, right? That's the sealed hole. Right? If you were to put your finger there, you'd feel there's a little bit of a depression. Now, 2 other things that we see on this dissection right here, and I'm going to do this on a separate video. There's a part of the conduction system known as the SA node or the sinoatrial node. This is where our heartbeat originates from, the regular sinus rhythm. And then the second node right here as part of the electrical system of the heart is the AV node or the atrioventricular node. Like I said, I'll do that on a separate video. So we'll just kind of point them out now, and then I'll put that together for you on a separate video. Finally, at the bottom, this valve right here, there and there, we're seeing part of the tricuspid valve. It actually has 3 leaflets, hence the name. Now, they also call it, you could also call it, I should say, the right AV valve or atrioventricular valve. Most often in medicine, we call it the tricuspid valve. Here's that interatrial septum. We had mentioned that before. That's the wall between the right atrium and the left atrium, and it was made up of connective tissue. So those are the main features of the right atrium. Continuing down now. So here was the tricuspid valve that we just looked at. Now, connected to the valve are these cords right here, known as the chordae tendineae. Why are they there? Think about this for a moment. When the right ventricle contracts, its job is to push the blood upwards into a blood vessel. We don't want the blood to go backwards here into the right atrium. So this tricuspid valve closes. But What keeps the leaflets from flipping backwards so that blood doesn't go into the right atrium? Well, it's these cords right here, known as the chordae tendineae. They are attached to a muscle, if you see right here, right? There's one over here, there's one over here. These are known as the papillary muscles. So here's what happens. When the right ventricle is contracting, these muscles are also contracting. They tighten these strings, right, the chordae tendineae, and that keeps the valve from flipping backwards so blood doesn't go back into the right atrium. You'll notice also, guys, they're here on the left side too. We're going to talk about this valve in a minute. This is the mitral valve. Same type of thing. We don't want the mitral valve to flip backwards and allow blood to go the wrong way. Okay, so this is what a common person would call maybe the heartstrings, right? Tearing at their heartstrings. This is what they're referring to, but we're going to call them the chordae tendineae. Here, papillary muscles. Now, all of these muscular ridges, if you kind of look in the background of the wall of the right ventricle, even on the left ventricle, we see them. These are known as the trabeculae carnae. They are the normal muscular ridges of the ventricles, right? And here we're seeing it in the right ventricle. The only one that can be a little bit deceiving, right here, right there, it looks like a muscular ridge. This is actually another component of the conduction system, the electrical system of the heart, known as the moderator band. Remember we said before this was the AV node and above was the SA node, right? So this moderator band is part of that conduction system. And like I said, I'm going to put that into a separate video. Now this moderator band is only found on the right side of the heart, not on the left side. So those are our features of the right ventricle. So let's move to the left side now. So now we're looking into the left atrium right here. So if you take a look, this is that pouch I was telling you about on the first slide. This is that little pouch that can take extra blood when a lot of blood is returning to the heart. This is the left auricle. Now, we're going to learn that the left atrium is where oxygenated blood from the lungs returns to the heart. So these four black circles here, 1, 2, 3, 4, these are the openings of the pulmonary veins. These veins are bringing oxygenated blood back to the heart from the lungs, right? So those are the main features, right? There's two coming from the right lung, there's two coming from the left lung. Now, the valve here and here that separates the atria above from the ventricle below is the mitral valve. Now, this one we could also call the bicuspid valve, or you could call it the left AV valve, atrioventricular valve. Your choice, they're all correct. However, in medicine, you tend to hear mitral valve more so, I would say. So that's probably the one that you should know if you are going into medicine. Okay, so those are our features of the left atrium. Finally, the last chamber here is the left ventricle. You can see, first of all, I didn't label it, but just to show you, the wall of the left ventricle here, take a look at it, is much, much thicker than the wall of the right ventricle. You can see here it's a little bit thinner. The reason for that is, and this is a little bit advanced, but when the left ventricle contracts, it's pushing blood into this big thing here, the aorta, that's going to feed the rest of the body of oxygenated blood. So the muscle is much, much thicker. It's going to be more powerful. But we'll talk about that in another video. So same as we had on the right side of the heart, holding the mitral valve leaflets down are the chordae tendineae, all these strings here, and the chordae tendineae are anchored by the papillary muscles, right, which contract, they tighten the strings, they keep the valve from flipping the wrong way. And then just like we saw in the right side of the heart, all of these muscular ridges are the trabeculae carnae. Both ventricles have that. And as I mentioned also, just to reiterate, the left ventricle does not have the moderator band. That was this over here. That's only on the right side as far as the conduction system. It is not on the left side. Okay, so the valves, just giving us a little bit of a different view. So what I did here is I just kind of took the front part of the heart that we cut off from the back part of the heart, and you could see um, the tricuspid valve here is the valve with the three leaflets separating the right atrium above from the right ventricle below here. So this tricuspid valve here and the tricuspid valve here. And then here's the mitral valve. Here's your left atrium. Here's your left ventricle. But if we close this on top here, they would be over here. So this is your left AV valve or mitral valve right there. Right, you can also call it the bicuspid valve, right? Just another view of the valves. Finally, for this lesson, I want to show you two other valves that are important. So let's start over here. This here is the right ventricle, right? That would be this part of here. Remember I said before, when the right ventricle pumps, it's going to push blood up into a blood vessel, right? We don't want the blood to go back into the right atrium. This is where the tricuspid valve is going to be closed. Where we want the blood to go is into this blue blood vessel here called the pulmonary trunk. I'm going to talk about that in a separate lesson. That valve right there that allows blood to go from the right ventricle into the pulmonary trunk is the pulmonary semilunar valve. You could just say pulmonary valve. That's okay also. I hear both. So that valve allows the blood to go into the pulmonary trunk and head to the lungs. Like I said, we'll talk about that in a separate video. On this side, the left ventricle, when it pumps blood up, right, we close the mitral valve. We don't want the blood to go backwards into the left atrium. We want the blood to go this way, and there's a valve right here so that the blood can enter the aorta right there. That is the aortic semilunar valve. You could also say the aortic valve, right? Both are correct. So these are actually showing the four valves of the heart. If I go back for a moment, again, the tricuspid valve is an AV valve. The mitral valve is an AV valve. And what I mean AV, it's between the atria and the ventricles. And then finally, the pulmonary semilunar and the aortic semilunar. These are the ones that are going to allow the blood to move from the two ventricles into the respective blood vessels. Again, from the right ventricle, blood is going to go into the pulmonary trunk. From the left ventricle, blood is going to go into the aorta. Now, these valves here, they actually prevent backflow, so blood doesn't go backwards into the ventricle. So this valve actually closes when the ventricles are filling. This valve prevents backflow of blood into the right ventricle. All right, so when the ventricles are filling, that valve closes. And these valves are what make your heart sounds, right? When your AV valves close, the tricuspid and the mitral, that is the first heart sound, like love. And then when the semilunar valves close, that's the second heart sound, dub. Okay, like I said, in a separate lesson, I will do the blood vessels of the heart.